Good morning, everyone, and thank you, Sydney Research and Sydney Local Health District, for this opportunity. As a trainer and a mentor at Cicada Innovations, we have a lot of clinicians and researchers who have developed technologies that come to us. And it's usually because that they've faced a particular problem in the clinic that they've gone on to develop a solution and worked on it for 4 years. And then finally they come up and say, well, I think this solution might be able to make me lots of money. I know, because this solves a really big problem and the market is really big. Then they go on and say, well, I've gone and designed this solution, I've gone and gotten some patents, and all I need now is funding to build, market, and sell the things. And these are gonna fly off like hotcakes, right? If you're someone like me in this situation, or you're an investor, a lot of red flags pop up. And we ask questions like, who is actually affected by the problem? What is the size, market size of the opportunity? Have they tried other solutions? And what are the other competition out there? So it's a lot of bias that technical experts in their fields, once you bring them out of their field and place them in a commercial world, it all seems to fall apart. And so in the next several minutes, I'll try and unpack how to get rid of that bias to help you commercialize your technology. So if you want to get investment for your technology, you need to be able to communicate in the same language as investors, and you have to be able to tell a story that resonates with them. If you look at your peers and see the ones that are receiving the most research funding, it's because they are able to tell a really good story, and this is the same for investors. If there is one message I want you to take away from today, it's that you need to de-risk the technology and the business model for investors through a story and justify it with evidence before they even think about writing you a big check. There are 5 areas you need to de-risk. The technology, does it actually work? The market, is it big enough? And do you know your customers? The sustainable competitive advantage, usually through patents. Is the competitors, are they able to actually go into the market and easily replicate what you're doing? We want to avoid this. The team. Does the team have a rounded experience, both technically and commercially, to be able to bring and execute the plan that you have to take it to market? So if we start off with technology, this is a technology readiness level thermometer. And it helps you assess how mature your technology is across a scale from TRL1, which is in the lab where you're doing your basic research, up to TRL9, which is when you are fully deploying your technology in the market. And so for this scale was developed by NASA about 40 years ago because they kept on launching rockets and they kept on failing and they didn't understand why. And they found out because they didn't have a common language across the contractors that were working on the different components of the rocket. And so this scale will help you assess where your technology is in terms of its matureness. And depending on where it is, different types of investors will be interested in your technology. For example, if you are looking for earlier stage seed funding by angel investors, you'll be looking at TRL 3 to 5, proof of concept to pilot scale. But if you're looking for much larger rounds of funding by venture capitalists, they are looking to at your technology at a much later stage where there's less risk. So between TRL 6 and TRL 8, as an example. The market. The market has to be big enough for investors to be interested in. And they want to know that you know who your customers are. And this is done through evidence-based analysis. So it's not good enough if you are looking through the literature, reading a report, and you're finding the market for X is $3.2 billion and is expected to grow at 11%. Because that is just as good as doing this. What investors want to see is that you're actually going out into the market and speaking with customers. And customers may be users, choosers, and payers. This may be patients, maybe the physician. It could be hospital administration, health insurers, and regulatory bodies. And so when you go out and interview customers, what you want to do is this, and you do it every day in your scientific research. It's setting a hypothesis, and in this case, it's formulating an assumption about your market or your customer. Then going out and speaking to as many customers as possible to then receive their feedback and understand what their pains currently are, what kind of gains they want out of a technology, and also how much they're willing to pay for it. You're not selling your technology at this point in time. You're just trying to understand why. And then when you collate all this feedback, you then go back to conclude whether or not your assumptions about your customer was correct or not. And so this forms your evidence to go to investors, say you know exactly who's going to buy your product and where you have to go to. Third, sustainable competitive advantage. So usually in the form of patents or trade secrets, investors want to know what you're actually patenting and where. It's not just going about for the whole world and protecting it everywhere. Are you protected for your biggest markets? That you don't necessarily want to go for your smaller markets because patent costs are ongoing and they are expensive. And also why? Team and execution plan. You should have at least 2 full-time employees on your team. Both have technical skills and commercial skills, because investors want to know that your execution plan can be done within a certain time frame so they can recoup their return on investment. The execution plan, have you thought about what types of trials you need to do and what approvals you need to get it to your biggest markets? And you also have to prioritize where these come into along a time frame. The ask. So you need to know how much money you're going to ask the investors. Not too little and not too much. Too little and you'll run out of funding. Too much, investors see this as lazy money. And they don't want to see their money sitting in your bank account earning interest, because quite frankly, they can do that themselves. So if I've left you with a lot of question marks in your head, or if you'd like to improve your commercial literacy, I'd like to invite you to join the Medical Device Commercialisation Program, which Cicada Innovations is delivering in partnership with New South Wales Health. So we have 3 course offerings: how to protect your intellectual property, how to search for the right business model and speak to customers, and also how to build a startup and also go through the commercialization journey of taking that from benchtop to the market. So the MDCTP has a great track record. And in the past 2 times we've run it, we've had 32 graduates who've gone on to start 9 companies. And they've broken down their biases and assumptions about the market and their customers through 729 interviews over 12 weeks. And these 9 companies have gone on to raise $15 million. We've now graduated a further 18 from this year, and 3 companies from that are now in due diligence to raise more funding. So if you want to talk to me later about any of the programs or about any of the topic of the day, visit cicadainnovations.com/MDCTP or come and speak to myself afterwards. Thank you.